Nursing MCQs. 1. A standardized test of gross and fine motor skills for adults. A. Glasgow Coma Scale. B. Pain Assessment Scale. C. Denver Developmental Screening Test. D. Bruin-Inks-Ozoretsky Test. Correct option is D. Bruin-Inks-Ozoretsky Test. 2. At what time is the insulin peak efficacy if nurse administered insulin at 9 a.m.? A. 9:15 a.m. B. 10 a.m. C. 10:30 a.m. D. 12 p.m. Correct option is D. 12 p.m. 3. Infiltration cool and elevation portion at fluid state. A. Transitate. B. Inflammation. C. Edema. D. Both A and B. Correct option is C. Edema. 4. A nurse is taking care of the patient with fluid electrolyte imbalance. She notices that there is redness around the forecannula. After touching, she found out that there is tenderness and foreflow is also decreased. What is correct interpretation of the following condition and the action? A. The finding is a normal after cannulation. Continue the foreflow. B. The finding is abnormal. There is sepsis. Stop the foreflow. Remove cannula. C. The finding is abnormal. There is phlebitis. Stop the foreflow. Remove cannula. D. The finding is abnormal. Wait for physician to provide you the order. Correct option is C. The finding is abnormal. There is phlebitis. Stop the foreflow. Remove cannula. 5. What is the compression to ventilation ratio for an infant CPR? A. 3:1. B. 3:2. C. 2:2. D. 3:3. Correct option is C. 2:2. 6. All are true about febrile seizure in children except A. Administer PCM as a part of management of febrile seizure. B. Risk of injury. C. Cerebral hypoxia is evident. D. Young age is not a major risk factor. Correct option is D. Young age is not a major risk factor. 7. Identify the given image below. A. Tinea corporis. B. Bed sore. C. Steam burn. D. Flame burn. Correct option is A. Tinea corporis. 8. A patient on assessment has found to have hypokalemia. Nurse is assigned to administer the which of the following intervention is not done? A. Intake-output chart monitoring. B. Potassium 4 solutions should be administered only in well-hydrated patients. C. Fast intravenous infusion. D. Potassium infusion administration should be through a large, high-flow vein. Correct option is C. Fast intravenous infusion. 9. A patient has fallen from the rooftop. Spinal injury is suspected. The emergency intervention in such cases includes A. Jaw thrust. B. Head tilt chin lift. C. Both A and B. D. CPR. Correct option is A. Jaw thrust. 10. Patient is undergoing blood transfusion and suddenly patient shows complaints of transfusion reaction. What will be the priority nursing intervention? A. Stop the infusion and remove cannula. B. Stop the infusion. C. Complete the transfusion and administer injection AVL. D. Complete the transfusion and discard the bag. Correct option is B. Stop the infusion. 11. In burn patients, isotonic fluid is given to prevent the risk of A. Renal failure. B. Inadequate lung perfusion. C. Hypovolemia. D. Electrolyte imbalance. Correct option is C. Hypovolemia. 12. Endotracheal tube formula for uncuffed child. A. Age in years /3.5 + 4. B. Age in years /4 + 4. C. Age in years/4 plus 3.5. D. Age in years/3.5 plus 3.5. Correct option is B. Age in years/4 plus 4. 13. Myocardial stress tests provide the following findings in ECG. A. ST segment changes. B. QRS complex changes. C. P wave depression. D. Both A and B. Correct option is D. Both A and B. 14. Which of the following food should be avoided when the patient is on MALI? A. Calcium-rich food. B. Tyramine-containing food. C. Gluten-rich food. D. Alanine-containing food. Correct option is B. Tyramine-containing food. 15. The doctor prescribes a patient to take inhaled beclomethasone and inhaled albuterol for the treatment of asthma. As a nurse, how will you teach patient to take medications properly? A. Beclomethasone first, 5 minutes later albuterol. B. Albuterol first, 1 minute later beclomethasone. C. Beclomethasone first, 1 minute later albuterol. D. Albuterol first, 5 minutes later beclomethasone. Correct option is D. Albuterol first, 5 minutes later beclomethasone. 16. A nurse has just performed an NG tube insertion procedure. Most accurate method for confirming the NG tube placement is A. X-ray. B. Auscultation. C. Observing patient for coughing, aspiration of content, and pH monitoring. D. Dip in a bowl of water. Correct option is A. X-ray. 17. Calculate the total back and one arm burn percentage. A. 18%. B. 9%. C. 27%. D. 36%. Correct option is C. 27%. 18. During peritonitis perforation laparotomy surgery is conducted, central line is administered in this case. What is the most important significance of the central line administration here? Correct option 1. A. CVP measurement. B. SpO2 measurement. C. ABG analysis. D. Fluid administration. Correct option is A. CVP measurement. 19. Black lung disease is caused by A. Coal dust. B. Cotton dust. C. Sugarcane dust. D. Asbestos fiber. Correct option is A. Coal dust. 20. Identify the given image below. A. Naegele's pelvis. B. Android pelvis. C. Gynecoid pelvis. D. Anthropoid pelvis. Correct option is A. Naegele's pelvis. Thanks for watching. Now subscribe MCQS Hub.